Josh, you have anything to add to the complete tears, a 2B tear? Would you attempt that arthroscopically, or you think that's best handled open?
Yeah, with a complete tear like that, I would refer to you guys. I think the strength of the repair for an arthroscopic approach for a partial thickness is comparable to that of an open repair, and clinical outcomes, I would argue, are comparable as well. For the full thickness with retraction, like you just demonstrated, I think it's in most people's hands that even do a high volume of these, it's probably not as strong a repair as an open. And so that's why I will refer to you guys for that. And, I think that your success in this case is actually really common. When I first started learning about, endoscopic repair of abductor tears, most of the literature had been written by Tom Bird in Nashville. He's written several papers on this area. And whenever he gives a talk on this, he always describes abductor patients as his happiest patients with the quote unquote hug sign. And these patients are pretty dysfunctional beforehand, so they start out really low. And the magnitude of improvement that you achieve is actually quite large. And so these are pretty happy individuals. It is a long recovery. You need to get the biology to heal and you need to increase strength, but these are really happy patients. And so even in a sports medicine arthroscopy practice like mine, these patients, they still are usually a pretty bright spot in the day.